Welcome to this webinar on bloating in irritable bowel syndrome. My name is Marianne Williams, and I'm a specialist gastroenterology and allergy dietitian. So let's have a quick look at an overview of bloating. Bloating is actually really common. It affects about 18% of the general population at least once a week, and it's most common in women. It's often associated with abdominal pain, nausea, and reflux, and constipation. And the highest amount of bloating that we see is in patients with irritable bowel syndrome. So it's really common within this condition. I've listed two research articles there, and you may find those helpful if you want to know more about this subject. So, how do patients describe what bloating feels like? Well, they'll describe a fullness, a swelling, a feeling of trapped gas, tightness. Some of them will say their stomach feels as tight as a drum. Or there are visible increases and it feels like they've got a balloon inside them. A lot of women will say, I look as though I'm 6 months pregnant. So it is really debilitating and it can have a significantly negative effect on your quality of life. And in fact, it accounts for one of the most common reasons for people seeing their GP. So let's look at what other conditions other than IBS should be ruled out before we assume that your bloating is caused by IBS. So, celiac disease would be the first condition. Now, this is an autoimmune condition where people eat gluten found in wheat, barley, and rye, and that gluten attacks the lining of their gut. And one of the symptoms, one of the many symptoms that these patients get is bloating or can be bloating. So it's really useful to rule out celiac disease. And this is a very simple blood test that's done by your GP. And the important thing to remember is that you need to be eating wheat or gluten every day for the 6 weeks before that blood is taken. If you don't do that, then the test isn't reliable and you won't really know whether or not you have celiac disease. So, eating gluten every day for 6 weeks, then have the blood test so that you can rule this condition out. The other consideration is where wheat has two components. It has the protein gluten, which we've discussed in celiac disease, and it has the fructans, which are carbohydrates inside the molecule of the wheat. Now, fructans ferment in the gut, and that can cause bloating. So, a lot of people we see who say that they suffer with bloating after pasta or bread or cakes, etc., often this is simply the fructans. So it's literally just plumbing inside the gut. Those foods get down, the wheat foods get down into the gut and they ferment, causing bloating. The other area that is really bad for bloating, causes bad bloating often, is constipation. Sometimes when the patients get rid of their constipation by using laxatives or changing their diet or changing their lifestyle, then they suddenly discover the bloating goes down. So, really important if you've got a history of constipation to deal with the constipation and see if that's sufficient to resolve your bloating. Other areas to look at are things like pelvic floor disorders, and that's not something that us as dietitians would get involved in. And you'd probably see a pelvic floor physiotherapist for that. And if they identified pelvic floor disorders, then they might give you treatment called biofeedback. And that appears to be pretty successful in effective in reducing bloating. So definitely something to consider, but you would need to see a specialist, as in a pelvic floor specialist, for that. The other area is ovarian cancer. Now, this is very rare and it's normally associated with other conditions, such other symptoms like difficulty eating or feeling full very quickly or needing to pee urgently or peeing more often, extreme fatigue and unexplained weight loss. So, really, if bloating is the only symptom you've got, you would not be thinking ovarian cancer. And I don't want anybody to start panicking that just because they've got bloating, they must have ovarian cancer. That is absolutely not the case. But it would be unprofessional of me not to mention bloating is one of the symptoms of ovarian cancer. You can go to your GP and get a simple blood test done, a CA125, have a physical examination, and get referred for an ultrasound, and then you can rule this out. But as I said, unless you've got a lot of the other symptoms associated with it, then it's extremely unlikely that you have ovarian cancer. Other areas we look at is something called small intestinal bacterial overgrowth, or SIBO for short. And this is very commonly considered. So a lot of people think, oh, I've got bloating. Have I got SIBO? There are breath tests that can be used, but in the latest research and guidelines, they say that actually these tests are very controversial and nobody can quite agree on what the test results mean. And therefore, they're not recommending these tests at the moment for people with just bloating. There are uh, antibiotics that you can take that can be prescribed by your gastroenterologist for SIBO, and you need to talk to your gastroenterologist about this if you think it's relevant. Other areas that can be helpful are psychological therapies like gut directed hypnotherapy or cognitive behavioral therapy, both of which have shown that they will help bloating. One of the questions we get asked a lot is, should I take probiotics? And actually, there really is not enough data to support their use specifically for bloating. Now, in national guidelines, they might say for IBS in general, you could try using probiotics for a month and see if they help, and maybe swap to a different one if they didn't help. But for bloating specifically, the new guidelines that have come out of UK, Europe, and America are not endorsing probiotics for use in bloating specifically. So, the other area that they might suggest is looking at dietary therapies. And I think it's really important, as they say, that dietary therapy should be done in the hands of a specialist gastroenterology dietitian. And fundamentally, they're looking at eliminating foods for 2 to 8 weeks. And if you're better, then looking at a planned reintroduction. And if you're no better, then going back to eating normally without any restrictions. So, what diet is seen to be useful for bloating? Well, the FODMAP diet, the low FODMAP diet, has been shown to be extremely helpful for bloating. And when we look at the information that came out of recent systematic review and network analysis for diet and IBS, now that's a lot of long words. Basically, it means where they looked at all the research that had been done by researchers all over the world and put it all together and came out with what the conclusions were when they put it all together. So much better than looking at just one research article on its own. This was looking at everything. And when they looked at everything, all the research, the FODMAP diet was ranked number one for dealing with abdominal pain, abdominal bloating and distension, and change in bowel habit. And it was even shown to be superior to using our UK NICE guidelines along with the British Dietetics Association guidelines for bloating and distension. So the FODMAP diet appears to be extremely useful for bloating, but it is a complex diet and it should not be your first port of call and should only be done with a dietitian who specializes in that area or with digital formats by specialist dietitians. So I just want to, as I'm a dietitian, I just want to go into the low FODMAP diet in a little bit more detail because they say that it is useful for this. I think it would be helpful for you to know a bit more about it. So the principles behind the low FODMAP diet is principle one, osmosis. Now, in simple terms, that just means water moving into the small intestine, which then results in loose stools. So if you note at the bottom, if you suffer with constipation, this movement of water could actually be helpful. It might actually soften your stools. So actually taking all the FODMAPs out and having less water moving into your intestine might make your constipation worse. So really important to understand that osmosis and the fact that the FODMAPs cause water to move into your small intestine. The principle number two for the FODMAP diet is fermentation. And this is down to gas being produced by the bacteria living in your large intestine. So, got a picture here of a sourdough starter culture. Exactly same principle in many ways. Those little gas bubbles that you can see against the glass are where the bacteria in that sourdough culture are fermenting and causing gas bubbles. Now, that is exactly what is happening in your gut. So, the amount of fermentation that happens in your gut might depend very much on how many of these fermentable foods you've eaten in a short period of time. So, what the FODMAP diet does in simple terms is it eliminates all the osmotic and gas producing foods, but only for 4 to 8 weeks and only with the guidance of a gastroenterology dietitian. And reintroduction is really important. The FODMAP diet has been shown to have negative effects on some gut bacteria. So appears to only affect bifidobacteria, but the important thing is those bifidobacteria return to normal once the reintroduction process starts. but that highlights how important it is to have specialist dietetic advice. And there's another reference there at the bottom that you might want to look at from 2022, looking specifically at this. But very important, you don't stay on the FODMAP diet long term. You need to protect your gut bacteria. You need to do that reintroduction process. So the reintroduction process is really important for your quality of life. A restricted diet is really difficult to follow and socially isolating. Any of you that have done these sort of diets before will know that you go around to friends and say, "Oh, I can't eat this," or you go out to the pub, "Oh, can't have that, don't eat, can't eat." It just becomes a bit of a nightmare. So it's really important that you learn what of the FODMAPs you tolerate so that you can basically return to pretty normal eating with the knowledge of which FODMAPs you need to be careful of, because it won't be all of them. And is the diet suitable for those with constipation? Because we've touched on that already, haven't we, with the osmotic effect. So the osmotic ability of some FODMAPs to allow water to enter the small intestine. Well, if you remove these, then you're going to have less water entering. So although you might stop diarrhea, you might actually make constipated patients more constipated. So, for instance, prunes are a classic example of a FODMAP, and we give prunes to people with constipation because prunes help water enter the bowel and help their constipated hard stools become softer. So we need to be really careful with those with constipation, and we need to look at perhaps using the FODMAP diet, but making sure they eat plenty of low FODMAP fruit and veg, at least 5 portions a day, 80 grams per portion. So you're getting lots of fiber there. Jumbo oats, oat bran, brown rice, whole grain sourdough, spelt bread, nuts, etc. 2 kiwi a day is a natural laxative and they're low FODMAP, so that's very helpful. And drinking a minimum of 1.5 to 2 litres of non-caffeinated fluid a day. Work up slowly over 4 weeks to allow your bladder to acclimatise. So don't suddenly change from one day to the next to having 2 litres if you've been having only 1 litre a day. Just do it slowly and gradually over a number of weeks, over 4 weeks. Build up slowly. So if you do all of those points and do the FODMAP diet alongside them, then we hope that we will prevent that constipating effect of the FODMAP diet. So, in summary, rule out celiac disease, pelvic floor disorders, and ovarian cancer, but only if you've got all those other symptoms or a lot of those symptoms linked with ovarian cancer. I don't mean everybody going to their GP and insisting that they get a test for ovarian cancer, because for most people it's not relevant if bloating is your main symptom. So if you've got the other symptoms in the slide that I showed you, then perhaps talk to your GP about testing. Consider the fructans in the wheat that might be causing the bloating, treatment for SIBO, but that needs to be done with a gastroenterologist, treatment for constipation, which you can very much control using the points that I've just gone through, plus laxatives if necessary. Consider gut-directed hypnotherapy and consider cognitive behavioral therapy, as those also help with bloating. Dietary intervention appears best from the low FODMAP diet for a maximum of 8 weeks. I think it's important to underline that IBS is not associated with food allergy. So, allergy testing is absolutely no use in IBS. If you think separately that you might have food allergy, then you need to see a specialist allergy dietitian. The FODMAP diet eliminates foods that ferment in the large intestine and cause water to enter the small intestine, and should be done with the guidance of a specialist dietitian. And FODMAP reintroduction is absolutely essential after 8 weeks to protect your gut bacteria, improve the quality of your life, and determine your tolerance levels to the different FODMAP foods, because you won't have a problem with all of them. It'll just be a few of them, and you may still be able to have some of all of them, but in measured amounts. So just make sure you do the reintroductions that you can return to normal eating. There are helpful areas to get advice, like the First Line British Dietetic Association IBS advice. The link is listed here, and if you type that into your browser, you'll get the information. Monash University have a grand tour guide of how the FODMAP diet works, and I really recommend watching this. Again, just copy down that link into your browser and it should come up. That's a really good visual representation by Monash University of how the diet works, and really underlines how FODMAPs are and the effects they have on the gut are all to do with the plumbing in your gut, nothing to do with your immune system or allergy. Useful resources and including information on the latest Monash cookery book can be found at this link. Again, type it into your browser, and they've also just produced a very good new cookery book which you might find helpful. With the actual FODMAP diet, either see a dietitian for help and advice or watch a low FODMAP webinar that has been created by a specialist gastroenterology dietitian. There is a lot of information on the internet which is out of date, incorrect, and will lead you up the wrong way. So make sure that if you're going to listen to digital information, that it is from the correct source. There's lots of stuff on YouTube, for instance, which is not very helpful. So there is also a low FODMAP diet on this website. This webinar gives you details of exactly how to follow the diet safely, gives you downloadable copies of all the slides, including the most up-to-date lists of foods that are safe and foods to avoid. It gives you a list of FODMAP manufacturers, and it also gives you really detailed advice on the reintroduction process with, again, downloadable slides so that you can follow this process safely and effectively. While most of the webinars on this website are completely free to access, this one, because there's so much work gone into it and it's so much detail and so many downloadable handouts, there is a small charge of £25. But compared to seeing a dietitian in person, that's a very small cost. And if that's all you need to be able to follow the diet safely, then that's great. A lot of people may need to see a dietitian in person, in which case to go and see an NHS dietitian that specializes in this area or a private dietitian, both of which would be very helpful. So, thank you very much for listening to this short webinar on bloating in IBS. And my website is wisediet.co.uk, and you can email me on marianne@wisediet.co.uk. I also have an Instagram account, Gut Webinars. I hope you found it useful. Thank you for listening. Goodbye.